But we're going to move on without further ado to our next speaker, who is Rachael Masters. Rachael Masters is a senior specialist dietitian based up in Durham and Darlington, where she's done some really pioneering work looking on transforming the nutritional care of many older patients within the community and in care homes. And she's won a number of national awards in recognition of the work that she's done. And hopefully she's going to share some of those insights with us today. So thank you very much, Rachael.
Can I just thank Anne and Tom for inviting me today to come and speak about the work that we've done with Focus on Undernutrition. Well, I've been working on the Focus on Undernutrition work for 17 years now. We started it back in 2000 in County Durham and Darlington. Just to put things into perspective then, undernutrition is a major health problem in the UK, as Anne's already spoken about, and it's a major cause and consequence of poor health in older people. Up to 3 million people at any one point in time are at risk of undernutrition, and we know from the research that 35% of our residents who've recently been admitted to care homes are at risk of undernutrition. But the cost both to the individual is unbelievable, with the impact on quality of life, like we've already heard about from Anne, but also on the health economy, where it's costing £19.6 billion a year in England alone. And we know that if we can just tweak how we look at the way we treat and identify undernutrition, we can have a major impact on the health economy, because, as Anne's already said, it costs 3 to 4 times greater the cost of undernutrition to look after somebody than someone that is well nourished. But undernutrition, it can be largely preventable and treatable, I believe, and NICE has already shown us from all the guidance that we have out there that it's the 4th most cost-effective guideline due to the impact it can have on reducing complications, hospital admissions and death. And if we just tweak how we treat undernutrition and can save just 1% a year, that can save over £196 million a year annually. Now, when I first started Focus, there was virtually no nutrition guidance out there for undernutrition, but nowadays we've got a whole plethora of it. There's absolutely tons of guidance, and we don't need any more guidance, I don't believe. I just think we need to put it into practice and embed it into our everyday working practices. And that's what I believe we do as a team in regards to supporting care homes to practically put these guidance, which is quite complicated for some of the homes, into everyday working practices. So as a team, we provide free nutrition training to all of the care homes in County Durham and Darlington. We've got 125 care homes. Okay, so we're part of the Nutrition and Dietetic Service, and we provide free training to nutrition to all the care homes in County Durham and Darlington, and we've got 125 homes in our area. That means that we have all of our healthcare staff undertake about 6 hours worth of training through attending workshops, doing e-learning and distance learning workbooks, and all of our head cooks, assistant cooks and home managers come on a 6-week catering course on special diets and menu planning. And I should actually be there today. We've had to delay it a week because of the conference, and it's a very practical course that all of our cooks do. Also, before we start working any home, we ask the home manager to consent, and that so they're aware of what we expect the home to deliver after we've delivered the training. But part of that is giving us permission to collect anonymised data at baseline and evaluation on certain undernutrition measurements. Now, I started the service back in 2000 with a pilot, and the results of that pilot started the foundations for our current service, which we started to deliver in 2003, and then in 2009 we went to a team of 8 of us. In the current cutbacks we're back down to a team of 5 of us, just to put it into perspective with how things have gone. But we collect data when we start working with a home at baseline and at 6 months, and then we go back in every single year to re-audit that home against a quality standard that's got 18 different criteria they have to fulfil. And this is linked to funding with the local authority commissioners. So far we've trained about 105 homes, and that's about 85% of all of our homes in the area. Okay, so what do we do within the homes? Well, first of all, we train the homes on how to identify and treat undernutrition, and we use the MUST tool. That is the central to everything that we do. And then we promote a food-first approach using food as treatment and then the appropriate use of supplements. So if someone's moderate risk, we recommend 2 nourishing snacks a day, such as a piece of malt loaf, a little bit of cake, cheese and biscuits, some nuts. encouraging nourishing drinks such as milky drinks and fruit juice, and also a fortified diet where we'll take an everyday food dish like custard, soup, milk pudding, add a skim milk powder for the protein and cream for the extra calories, as well as a multivitamin and mineral tablet. If someone is high risk, it's exactly the same, but also we recommend 2 homemade fortified drinks a day. So in 200 ml is 300 calories and 10 grams of protein, so they mimic the prescribed supplements. But what we advocate, if someone is high risk again on the 2nd month and their weight has declined, we recommend they speak to the GP about prescribed nutritional supplements. So that is kind of the pathway that we promote. Now, Focus is acknowledged nationally, and also our homes speak very positively about our service. But one of the problems we had was we didn't actually know how effective we really were, and were we actually making a difference? We collected this data at baseline and evaluation, but we really didn't have a clue whether we really did make a difference. So I did my MSc during the last 2 years, and my dissertation was basically looking at the impact that Focus has within our care homes. So my aim of my dissertation was to look at the impact we had on undernutrition measures. We wanted specifically to look at the impact on weight for residents at risk of undernutrition. Also, did we impact the prevalence of undernutrition and also pressure sores? It was a retrospective, which means it was looking back in time, a service evaluation for 13 years, from 2003, when we went live as a service, to the end of 2015. And we actually used all the data that we'd be collecting during that period, which was anonymised data from our resident records. And we analysed it on an access database and statistical programmes. And we didn't actually need ethical approval, but we'd already asked approval before we stepped foot in the home from the managers who consented to us collecting the information. So as part of the work that we did, we had 104 care homes, and 86% of them provided with both baseline and evaluation data. Unfortunately, 6% of those homes now are closed. There was 4,315 residents that were incorporated in the analysis as well. The high percentage were female, over 70%, and 92% of our residents were aged between 70 to 100, which is what you would expect, but the most prominent age was 80 to 89. Residential was the highest category of care with 53%, and 38% of our residents had a diagnosis of dementia. Although the most prominent length of stay was less than a year, the average length of stay was 28 months. So when we looked at the 3 criteria in particular, what we found was that we did actually make a positive difference to the weight of residents at risk of undernutrition. So you can see moderate, low, moderate and high risk. Red is baseline, green is evaluation. And prior to going in, we found that residents who were moderate and high risk were losing significant amounts of weight. But following our training 6 months later, there was a kind of a reversal in this. And you can see with the high risk ones in particular, they're now starting to gain weight again. And when you look at this between groups for low, moderate and high, there were statistical differences both at baseline and evaluation, and overall there was a huge difference. And it was done at the rate of weight change per month, because we were conscious that the length of time the resident had been in the home was a confounding factor. So we analysed the data to account for this. When we actually looked at the risk of undernutrition again, we did find that we did make a positive impact here as well. So just to put it in perspective, when we did the pilot back in 2000, 44% of residents were at risk of undernutrition, and this declined to 38% 6 months after the training. We saw at the beginning the national average is 35% on admission to a care home. What we were finding locally was that it was nearly 33% were at risk of undernutrition, and that declined to 29% 6 months after the training. Nationally, there is a reduction in undernutrition in care homes, and I believe that's because of all the really positive work that's been happening nationally, and I just think the homes have really embraced improving nutritional care over the last 15 years. It's been a phenomenal improvements in what we've seen locally as well. What we also found was there was huge improvements in screening, and screening is a requirement by CQC, but less than 80% were being screened when we went in at baseline, but following the training it went up to nearly 99%, so there was significant improvements there. So finally, the last area that we looked at was pressure areas. And when we went in at baseline, you can see that the higher your risk of undernutrition, the higher your chance of developing a pressure sore is. And this was statistically significant between the groups. But at evaluation, there was no difference in your risk of undernutrition, in your risk of developing a pressure sore. But overall, there was a 51% reduction in pressure sores within the homes, which just blew our brains when we found these results out, because we read about it in the literature. To actually see it there in your homes was really amazing. And we found when we did more statistics on it that the odds of developing a pressure sore after our training reduced by 53%. So we feel now, as a home, as a team, we can actually say that we do positively impact undernutrition measures within our care homes, both in improving the rate of rate change in residents at risk of undernutrition, reducing the prevalence of undernutrition, and also reducing the prevalence of pressure sores. And just to put this into perspective, our service is delivered by dietetic assistants. It's not delivered by dietitians. So we've proved this, that through dietetic assistants we can improve nutrition outcomes. But also, what I want to be able to do in the future is every year we go back in and do annual reviews, is now look at how we can prove we're continuing to improve that care on a long-term perspective. But what we say is, actually, as a team, we don't believe we've achieved these results. We believe it's the homes that have achieved these results. We've probably had 10 to 15,000 people go through our training over the years. We only go in and do that 2-hour session, and they do our workbooks, or they go to our catering courses, we do our annual reviews. But it's those staff that have come on our training that have then put this into practice in our care homes, whether that's through screening or whether it's providing the nourishing snacks, the fortified drinks. But one of the ethoses I've had ever since I started Focus is keep it simple, because all of our homes are rushed off our feet. It's like any area of work, everyone's busy. So if you can't keep it simple, what's the point in doing it? And that's what we've tried to do with all of our interventions. So if you want more information on Focus, we do have a website, and there's also videos on there about us completing MUST and mid-upper arm and ulnar as well. And I know we're going to have questions at the end as well, so that's everything. Thank you.
Thank you very much, Rachel. I think Rachel there, through her work and the work of her team and the work of those she's supported and educated, has shown the power of nutrition, good nutrition in particular, on the lives of those residents in the care homes. So we chance to ask Rachel some questions about that later on.